So thank you so much for joining the AAHPO Town Hall. This is part of a continuing series that we've been doing since the beginning. And our goal is to share all the known evidence and facts with all of us so we can make better decisions for our families and organizations that we are in. I'm really very grateful for all your support to our frontline providers, our nurses, our social workers, psychologists, and physicians who've done so much to help us heal. To our researchers, including some on the call tonight, like Dr. Belenkian and others who've contributed original research that have helped us understand this virus and deal with it better. To our donors and all the organizations that have participated on these town halls for their assistance in being a megaphone for us and getting the word out there for this public service. And that would be the Armenian General Benevolent Union, the Armenian Engineers and Scientists, the Armenian Missionary Association, many of the churches in the Eastern Diocese, Fund for Armenian Relief, the Karagoshan Foundation, Knights of Vartan, Armenian Radio Hour, and the Voice of Armenians. A little update on vaccines. We were humbled this week and reminded that vaccine development is not a given. It's just not going to happen when you snap your fingers. This week, one of the leading makers of vaccines globally, Merck & Company, scrapped its plans for developing 2 COVID vaccines after they both did not perform well in clinical trials. Just making it that much, reminding us how amazing it is that we have as many vaccines that work as we currently do. Whoever thought in the deep days of March and April, May, that we would have 8.4% of the American population having received 1 dose of the vaccine. 2.1% of us have received both vaccines or are fully vaccinated. This week was a milestone in vaccinations. We now have more Americans, 27.6 million Americans who've been vaccinated versus 26.6 that have had COVID-19. It's worldwide. We have 119 million doses of vaccine given in over 67 countries. That's at a rate of 4.5 million a day. And in the United States, we now are at a rate about 1.34 million a day. So it looks like the original projections from the director or co-director of the Operation Warp Speed are going to be true. By the end of March, we'll have about 100 million Americans vaccinated. And if this schedule continues, it looks like we should have a significant number of people vaccinated, sufficient enough to go to a baseball game by October, which is what Dr. Fauci said. Having said that, we all are aware that there is a new mutated virus, which is highly infectious, and it's going to probably be the predominant strain by the end of March. So there's some rough roads ahead, despite this good news that we're having. Where do you want to live to be vaccinated? The best place would be American Samoa. About 17% of the population have been vaccinated. Alaska is the best state at 14%. The New York, New Jersey, Connecticut area, anywhere between 8 and 11%. It's not easy to be vaccinated. Right in the beginning, you can make a phone call and make an appointment. Right now, you're limited to registering via the computer, and there's multiple different places to register. What is challenging, and I think we all need to be aware of, is the most vulnerable amongst us are our elderly, and the least tech savvy amongst us are the elderly. So we really have to watch out for our older citizens, particularly those that don't have children, nieces, nephews, or friends that can help them register. I think this is something that our churches should focus on and our organizations, identifying those older individuals in our community that need help registering for the vaccine. It's really with great pleasure. Everybody knows Dr. Kim Malikian. She's an all-star. And Kim, thank you so much again for your participation and conveying so much information on Sunday's town hall. We're doing another one this Thursday evening, and thank you for helping organize that. So Kim, please make us aware of what's happening here in the world of COVID.
I don't have updated graphs this week, but the cases continue to decrease in Armenia, COVID cases. The news in Armenia, I think, which is relevant, is they are figuring out what to do about vaccination. They have listed a criteria of eligibility. It would appear that the original, they were originally slated to receive a certain amount of doses from AstraZeneca, the Oxford University vaccine, and that AstraZeneca vaccine is having production issues, so Armenia may receive less in the beginning than they had originally hoped for. But at the same time, there was a new study that came out showing that one dose of the AstraZeneca vaccine does have a relatively high level of efficacy, and therefore maybe the 2 doses will not be needed, at least as a preliminary tool to reduce hospitalizations from COVID in Armenia. They're also looking at the Russian vaccine, the Sputnik, and that has recently had one peer-reviewed journal article reviewing their efficacy in the Lancet this week as well. And the Sputnik itself will be very affordable. They are marketing on the open market. Their vaccine will cost, I think, about $10. And so that may become an option for people in Armenia. And as well, I know that the Chinese are also interested in having their vaccine also be available in Armenia. So those discussions are ongoing. Cases, though they're coming down, are still quite high. Hospitalization is still quite high. And we are seeing a plateauing, not a decreasing in the number of deaths per day as a result of how long the lag is between increased cases and then seeing, a decrease in cases and a decrease eventually in daily deaths as well. So that's all I have. I'm sorry I don't have graphs for today. We'll have them again next week.
I'd like to now introduce John Belenkian, who really doesn't need any introduction, but he is an amazing member of AAHPO, and we really appreciate everything he does. He's the Dorothy L. and Daniel H. Silberg Professor of Medicine and Pharmacology at the Vagelos College of Physicians and Surgeons, the Vice Chair of the Department of Medicine and International Research and Education, Chief Emeritus of the Division of Endocrinology, Director Emeritus, the Metabolic Bone Disease Program at Columbia Medical Center, and the founder of the Osteoporosis Treatment Project. Thank you so much, John, for joining us tonight.
I usually make a comment or two, so thank you for formally asking me to make a few comments. I thought it would be useful to go back about 4 years. We are so quickly used to medical progress. This vaccine, that vaccine, we've got many in the pipeline. And as you pointed out, Larry, there have been more people vaccinated now who then have had COVID in the United States. But I want to remember very vividly a lecture given in Armenia, and I think it was about 4 years ago at the last international meeting. And a bioengineer was invited to give a talk. This bioengineer, you all know, is Nubar Afayan. And he started to talk about a new project that Flagship Industries had begun. He had a disclaimer by saying that he wasn't a physician, and this was something very new for him. And over the next 45 minutes, he began to describe in, I would say, eloquent terms, the new idea that you could stabilize messenger RNA, you could package it in lipoid vesicles, get it through a very complicated maze, namely the plasma membrane of the cell, and direct that messenger RNA to transcribe proteins. And I listened to this talk, and I was amazed. I have a background here, but I had never heard that one could ever have done this. The first paper I ever wrote was on messenger RNA. And then Nubar went on to say that we just spun off a company called Moderna to see if this idea could be a prelude to developing proteins such as one would need for antigens for vaccines. This was about, I think it would be about 4 years ago, July. I can't remember exactly when it was, but I've never forgotten that lecture. And now, as you know, the rest is history, but it is really remarkable biomedical science that has prepared us unwittingly for the ability to deal with this terrible virus and within a year have effective and safe vaccines. And let me remind all of us that 40 years later, we still do not have a vaccine for HIV. So this puts it into perspective, and I think it's worth remembering that these things don't come easy. Nubar said in that lecture, he said, for every failure of my young people, I tell them around the corner might be your first success. So this is like worth remembering because we're in a way, if we don't remember history, we're going to repeat it. And in this regard, it'd be nice to repeat history in this regard. Just a couple more comments to follow Kim's point about the vaccines. As you all know, the Johnson & Johnson vaccine, which has, I don't think it's been approved yet, but it's been requested for emergency approval in the US, that would be a one-dose administration. And the other thing that was in the news this morning, and a clinical trial has started in England on this, is the notion that you could combine vaccines. That is, start with Moderna's and then go to Pfizer or go to Oxford or go to Johnson & Johnson. And they've just started a trial to see whether or not you can mix and match. And there's some very interesting science behind this that could potentially potentiate the effect of one vaccine by following it with another vaccine. But on the other hand, and I see George is on the phone, I'm sure you're going to say something about this. You can see downsides to this very interesting idea. In fact, I'd like George to follow me to make some comments about this, because it's really fascinating to think, because these various antigens are not the same, and it's potentially likely that the response to the host to different antigenic stimuli might actually have a greater beneficial effect than a double dose of the same vaccine.
Maybe George can comment on the latest work done on interferon in finding that a bad outcome, it might be related to antibodies to interferon. Just for those of you that don't know, Dr. George Malikian. George is a great man. He's board certified in internal medicine as well as infectious diseases. He's the director of infectious disease at the Fauci Medical Group, not related to Fauci, but you say Facey maybe? He's a principal investigator of many clinical studies, a regional medical director for the AIDS Healthcare Foundation. He has a master's in biostatistics from Yale. In the middle of the pandemic, before being vaccinated, he was part of a large team that put himself in harm's way and went to Armenia to survey the situation and help as best he can. Thank you so much for joining us today.
Thank you, Larry. I appreciate the introduction. I actually got COVID in Armenia. And just as an aside, the vaccines were really, I had the Moderna vaccine, and it really laid me out. The second one, actually both of them. And when I say laid me out, I mean, I had a severe headache after the first one. And after the second dose, I was really out of it for about 3 days. I barely scraped myself off the floor to go to work. Likely that's from a hyperimmune response for me. You've already had antibodies made, and so you're getting challenged again. As far as, thank you for, you raised some interesting points about the vaccine. The J&J vaccine, actually a very close friend of mine from undergrad is an immunologist at J&J, and he was involved with the vaccine. I just spoke with him today. So the one-shot vaccine that they're developing, it had some really interesting results. The efficacy rate in the United States was 77%, but there was a large gradient. I don't know if any of you have seen the data on this. There's a large gradient between different parts of the world, particularly in South Africa. the efficacy was down to 57%. And there is a concern that may be due to the new strain that's down there, the B1151, I believe it is. This has been the latest, sort of buzz in the infectious disease community is the issue of these new highly infectious strains, and then data coming out of Brazil showing really recalcitrance when it comes to herd immunity. There were two papers that recently came out, one in the Lancet and one in the journal Science, presumably the one in Lancet was more medical in nature. And what they were looking at is they showed that in Brazil, and I can't remember the name of the city, it wasn't Sao Paulo, but they had achieved, using population sampling, I mean, they didn't obviously sample everybody, but something like 73% herd immunity in the population. And then the virus, this was back in April, May, and then just recently the virus has taken off. It's going through a huge wave, and it's raging higher than it ever has. So there is no specific data on the question is is the immune system, is the virus evading the immune system? And there is in vitro data to suggest that this new strain that's circulating down there is playing games with the immune system, that it's evading. But what the holy grail for us obviously is documented cases of reinfection, and that still hasn't come up yet. You wouldn't believe there is actually there's a number of actual documented reinfection cases. If anybody wants to take a guess on the entire planet, it's 30 cases of that. So it's almost zero basically. And for it to be documented as true reinfection, the virus has to be sequenced both times. You have to show that it's a completely different sequence and be separated, in time between the first and second episode, and that's very rare. So we're not at that point, but there's a lot of concern about immune invasion. The other thing I wanted to say, as far as this new strain, I actually know that when I was a fellow, I was working with this other postgraduate named Eric Volz, who is the guy who because we were both working on network theory models. He's the guy who actually discovered the new strain in England. He's at that Imperial College right now, and he was the one who discovered it. I spoke with him about 2 weeks ago about this new strain that's raging through England, and he told me himself that there's absolutely no evidence that this new strain is more deadly. It's just more contagious. And the way they figure this out is they look at regions, they look at what the predominant strain is, and then what they do is they do phylogenetic mapping, and you show that one strain replaces another strain by simply being able to infect more hosts. One of the theories, interestingly, why is this happening? One of the theories is if you couple, this is just a theory, obviously it's not my theory, it's Eric's theory, but he was saying that if you couple strict lockdowns without introducing low-level herd immunity in the population, for example, with younger folks or anything to kind of dampen the spread of the virus, what you're really selecting out for is more infectious strains. I think the analogy he used is, imagine that, the sound of my voice, anybody who can hear the sound of my voice would be infected. So if you have in a population somebody who can speak louder and everybody's locked down, if you could speak louder or scream, and that's the equivalent of being infectious. So you're selecting for something like that instead of having a low-level competition between various strains. That's about it. The pandemic, I can't speak for the whole world. Here in LA, it's slowing down. The number of new cases are over the peak on the way down, but the death rate is still staying steady, and hospital beds are starting to open up a little bit.
I want to thank our panelists, Dr. Akimian, Dr. Belenkian, and our guest panelist, Dr. Malikian. Thank you. You guys were wonderful. And it really is a great honor to introduce our next speaker, who I'm meeting for the very first time, who has a lot of energy and is doing a lot of great things. Again, it's a pleasure to introduce to you Armenia Belenkian. She's an occupational therapist. She is the founder of Therapists for Armenia, and we definitely look forward to hearing all about your work and what your mission is. She promotes the inclusion of people with disabilities in the Armenian community, and her specialty is working with individuals with intellectual and developmental disabilities. Armenia, thank you so much for joining us today, and we look forward to hearing what you have to say.
Thank you for having me. As Dr. Najarian said, I am the founder of Therapists for Armenia. Let me also just talk a little bit more about myself. So really what has led me to founding Therapists for Armenia was my experience after graduating from Columbia. I did Birthright, and I worked with Children of Armenia Fund with Co-op, and I helped to pilot an occupational therapy program with them. I was their first ever occupational therapist, and so it really got me heavily involved in the field in Armenia and understanding what it is that like how occupational therapists work there, access to care for people with disabilities, and also their interest in learning more strategies from the diaspora. And so when I returned, I also met many people in the diaspora who were interested in getting involved in the therapy field in Armenia, but didn't really understand that therapy even exists there. What does it look like? How do they work? So anyway, so that's what led me to found Therapists for Armenia in 2019. And so I really wanted it to be very inclusive and multidisciplinary, since that's ideally how we work in our clinical settings, is with a lot of collaboration with all the other clinicians. And so we have members from many different countries, and different disciplines, and really the goal is to connect therapists, share resources and knowledge to enhance our clinical skills and ultimately help our Armenian communities thrive. So what some projects we've done in the past are newsletters, we've had webinars, we've also most recently with the displaced children, we created an activity book with different Armenian artists and occupational therapists, which we actually got 8,000 books donated to children in Armenia and in Artsakh. And we've also created Armenian social stories about COVID, about grief and coping skills. But our biggest emphasis currently is on rehabilitation. So this is really where our current efforts are focused. And just a little bit about the situation in Armenia. It's estimated that there's approximately 10,000 wounded soldiers. There's about 7 rehab centers who have wounded soldiers. Some of them are pediatric clinics that are now opening their doors also to see the soldiers as well. In terms of rehab, not every center has the core rehab that we think of here of OT, PT, and speech. There are a lot more physical therapists in Armenia. There's also a division in the field between, there's physiotherapy, there's kinesiotherapy, some do more modalities, some do more manual therapy. And most of the therapists have only worked within pediatrics, so there's just a lack of experience as well with a lot of these injuries. Some of them are volunteering their time in addition to working at their full-time jobs to work with the soldiers. And so the most common injuries that we have been told are related to orthopedic injuries, peripheral nerve injury, and amputations. There are also many other injuries related to TBI, spinal cord injury, burns, wound care, and also a lot of secondary complications due to a lack of early intervention. So a lot of contractures, DVTs, pressure ulcers, and infections. In addition, we've noted that there is just very not the most modern equipment available at the rehab clinics. They also don't really have a lot of adaptive equipment in terms of reachers and sock aids and things for dressing and self-care that really help promote independence. And splints are also not easily available. There is a clinic in Yerevan that does the prosthetics and orthotics, but there seems to be a delay in when those are available for the patients to use. And then also just the rehab culture in Armenia is also, it's a very new field, and there isn't as much awareness about the benefits of rehab and the importance of rehab from an early stage. And so this presents with a lot of challenges that we are trying to address through some of our different projects. So one big thing that we're working on is creating a resource library. And so this will have information related to the diagnoses that we've been told are most prominent, and also things that we know from a more experienced perspective of other issues that can arise from injuries like this. And so within all of these areas of need, we are addressing evaluation, treatment, clinical resources, and patient education. So all of our resources, we are working on getting them, eventually they will be translated, and we are also working on a website where all of our resources will be available on the website. We also have been doing weekly webinars. So this we started in December. So we're now on our third month of the webinars. And the webinars really focus heavily on treatment intervention. We really want to help prevent those secondary complications, and we're really trying to promote evidence-based practice. And our webinars are always both in English and Armenian through the help of our amazing volunteers in Armenia. And we just recently started with simultaneous interpretation. So we are really excited about that. And we are continuing with these webinars through March. And some of the topics we've addressed in the past was an introduction to physical therapy for orthopedic injuries. We've done, therapeutic interventions for pre-prosthetic management. That's what this image is showing. We've done introduction to rehab for burn injury. We have topics coming up related to hand injuries, neuro rehab, spinal cord. So we're really pulling in clinicians and experts, both from the diaspora and also just from our own networks, and also just people who have reached out and are willing to help. And so these have been really exciting, and we're really gaining quite a following from that. And also we are closely working with Armenian American Sports Medicine Coalition. We're really like partners in our rehab efforts. We've done everything together throughout this whole, these past few months. And so a big area that they are involved in is sending volunteers to Armenia. And so there's been mostly physical therapists who have gone, but we are also hoping to have some more occupational therapists and speech therapists going as well. They've also sent other healthcare workers as well, including physicians and surgeons. So they've really been heavily involved in that. And then also they helped to create this Tele support group where an OT, PT, and speech therapist are partnered with one specific clinic to help with consultation with specific cases. And then we're also connecting with them to, again, help with the resource library that we've collected, and also just identifying the needs that are coming up most frequently through their experiences. And so we do have some goals and projects in mind for the future. There is a big need for rehab supplies. We would like to do a rehab conference. We're, in talks with trying to improve the quality of education as well, and also advocacy to help create permanent rehab positions in hospitals and really get acute care rehab going and growing. And we also eventually would love to help promote practice acts and professional associations and licensure for the different therapy disciplines. And again, this is all together with Armenian American Sports Medicine Coalition. We are partners.
You did an outstanding job, Armenia. Thank you so much for making your debut. I think we're going to be hearing a lot more from you in the future, and anything we can do to support you, please don't. You're in New York. We're in New York. We're in New Jersey, actually, the other side of the river. Just reach out anytime.
Thank you. I appreciate it. I definitely will. And thank you again for having me and for listening.